The assistant has the tray for the posterior amalgam restoration all set up, and also the dental dam tray is ready to go. The assistant has all necessary equipment out and ready to go, so that there are no delays when the dentist is working. The assistant has looked over the health history and has let the operator know about the health history and the treatment plan. And then the dental dam is placed. The assistant then transfers over the mouth mirror, and the operator retrieves the high-speed handpiece with a straight Fisher crosscut burr in place. The assistant maintains the operating field and thoroughly rinses and dries the preparation. The operator retrieves the low-speed handpiece with a round burr in place. The assistant maintains a clear preparation by using puffs of air. The assistant also changes the burr to an inverted cone and continues to use the air. The assistant then transfers the appropriate instruments, either the spoon excavator, hatchet, or margin trimmers. The assistant rinses and dries the preparation. The assistant mixes and places or transfers any necessary varnish, liner, or base. The pre-assembled retainer and band are placed on the prepared tooth. The wedge is then placed using cotton forceps. The tooth is etched, primed, and the bonding material is prepared and transferred prior to the placement of amalgam. After the amalgam has been retrieved from the amalgamator, the assistant puts the amalgam into the amalgam well. The assistant fills the amalgam carrier and transfers it to the operator. The operator places the amalgam in the preparation and receives the small condenser from the assistant and begins condensing. The process of placing and condensing is repeated until the preparation is slightly overfilled. The assistant exchanges the large condenser for the burnisher. The assistant transfers an explorer, then exchanges it for cotton pliers to remove the wedge. The Tophamai retainer and band are removed and retrieved by the assistant. The assistant transfers the appropriate carvers until the carving is complete. The assistant keeps the HVE close to the restoration during the carving process. During the carving process, the chart entry may be worked on. The assistant transfers dental floss and rinses if necessary. The assistant passes a moist cotton roll. The assistant transfers the scissors, then the forceps, and immediately retrieves the HVE to suction, rinse, and dry the patient's mouth. The assistant retrieves the articulating paper holder and immediately retrieves the discoid cleoid if necessary, and then retrieves the articulating paper holder. This step is repeated as often as necessary until the new restoration is proper in occlusion. A cotton roll is transferred to remove surface irregularities. The assistant rinses and dries the oral cavity and provides post-op instructions. The patient chart is completed and the patient is dismissed. The assistant then turns over for the next patient using Mercon products to clean thoroughly from any mercury that's left over from the procedure.